Good afternoon and welcome to this afternoon's Exec Q&A. My name is Tom Davis, the Interim Chief Executive, and thank you for joining me today. I'd like to just start with a thank you. It continues to be and has been a very challenging year to 18 months for this organisation, but for all health organisations and communities. And absolutely recognise the hard work that everyone in the organisation, within our employed staff and our volunteer colleagues, have dedicated to maintain a safe service to our communities during this time. You will have all noticed in the last 3 or 4 weeks, though, that as the country releases some of the restrictions, we have seen a significant increase in demand on our service, and I'm sure that's being reflected in everyone's daily work. We have learnt from 17, 18 and onwards. We have the experience that we gained through the winter and the peak of the pandemic to fall back on, and so we are absolutely confident that we continue to manage and mitigate the increase in demand through those mechanisms and to support both safe and responsive patient care. But it is absolutely key that we maintain that focus, that we keep ourselves and our patients safe, and we particularly, as demand rises, rely on our volunteers and other partners. And just as we move into next week, we absolutely recognise and celebrate the contribution that our volunteers are giving us as an organisation and our patients at this time. I wanted to just update the organisation on a meeting we had last week. So myself and a non-executive director chaired a meeting for our region's MPs. It was an extremely crafted meeting by the team, and I'd like to thank them for that hard work, but also a well-attended meeting from a stakeholder perspective. The MPs were very keen to pass on their recognition to our staff for all the hard work that has been happening in the pandemic, and so would like to pass that on today. But they also were keen to discuss people, performance and progress updates as we do on this exec Q&A. It was a positive meeting, and the MPs have asked that we go back with more detail about the CQC plan and about our plans to respond to the increase in demand over the next couple of months, and especially the summertime in our staycation resort locations, and we will do that in due course, as well as making it a regular event that we will meet with the stakeholder group, the MP group, on a bi-monthly basis after our public board. So as I hand over to Bob to carry on with some areas of people briefing, please do put your questions into the live Q&A question box. We will try and answer them, and if not, please do email me on the EEAST or my personal ESTAM email, and we will answer your question through that mechanism. So Bob, over to you. Thank you.
Thank you, Tom. Bob Champion, Interim Workforce Director. I'd just like to start by saying a thank you as well to everybody who's committing to participating in our culture change programme and involved in our management passport training as well. So a great commitment for people to try and change the way we do things, which leads me on to the first item, which is in relation to our pulse survey. So we are committed to the Equality and Human Rights Commission to undertaking regular surveys of our staff as to their experience within the workplace. And it's really important that all of you tell us how we're how you feel about working with EEAST, the good and the bad. And this survey, which is out at the moment, the Pulse survey, is the way to do that currently, so we can gather the results and work with you to improve our culture. This particular survey is open at the moment and ends on the 31st of May, and the link to access the survey is on Need to Know. So I'd encourage everybody who's in a position to do so, please complete the survey and encourage others as well. Thank you very much. And the next item is in relation to COVID travel regulations, and notwithstanding the confusion that has been publicised recently, we know that many of you who will have holidays coming will be keen to travel abroad this summer and beyond. And as the COVID travel restrictions are easing, some international travel is allowed, but it's governed by the new traffic light system. The pandemic rules can change at short notice, and so with the introduction of new variants and changes, so no travel is risk-free, but we want to encourage people, if they do wish to do so, to make sure that they access the information on the government website. And we've also put a new action card in relation to overseas travel, which has the latest guidance and links to the government website. That's available on the Need to Know. And for anybody who's in a position of granting leave, please speak to anybody planning to go abroad and make sure that they are aware of the latest guidance and ensure that they only wish to travel to countries where it's safe to do so. Thank you.
So thank you to Bob for joining me this afternoon. Thank you for everyone for your questions. And finally, as always, please do remember, whilst the pandemic rate is coming down, we are still in a pandemic situation. Rates can still go up as the country unlocks. It is absolutely important that we keep our focus on the measures that we need to adhere to, so PPE, COVID secure measures, face masks, hand washing, social distancing where we're able to. Even if we have had our vaccinations, then continuing to take our lateral flow tests in order to collectively keep ourselves and our patients safe. Thank you very much for your time. If you're listening back on out of the live session, then please do remember that the OC EEAST email and my own email, as well as those of the exec directors, are always welcoming of questions and comments, and we aspire to come back to you as soon as we can. But importantly, please do look after yourselves, please stay safe, and please enjoy the country as it locks down, but remember that we still need to not revert all the way back to where we were before the pandemic. So thank you for your time. Thank you to Bob for joining me, and look after yourselves and stay safe. Thank you.